Scientists have debunked a myth many of us had hoped to be true, that a glass of wine each day is not going to make you live longer. A review published this week found low-volume alcohol consumption was not associated with protection against death from all causes. Joining us live now is Natasha Robinson. She's the health editor at the Australian newspaper. Natasha, perhaps some timely advice here as many of us prepare to head off for a long weekend of Easter celebrations. Tell us, is this really right that the long-held view that red wine in particular is good for you is actually misguided?
Yeah, unfortunately so. This is sort of, I guess, the nail in the coffin for this idea, I would say. It's actually been sort of, over the past 5, 6, maybe 7 years, there's been study after study coming out which has questioned this idea that first sort of emerged maybe a couple of decades ago. And the way it's been described by people who follow this research really closely is that those early studies that identified, this sort of low level of consumption, maybe, in particular relating to red wine, a glass of red wine a day could have, health benefits and might increase your lifespan. Those studies were essentially based on pretty poor methodology. And as this research became more and more sophisticated, there's been sort of better designed studies which have consistently proven this to be false, unfortunately. And the latest study which has come out this week was published in the Journal of the American Medical Association. It was a meta-analysis, so it just looked at all the studies that have been done on this issue, and it was just hundreds of studies involving 1.5 million people, and it did find that alcohol consumption is associated with the high risk of mortality or earlier death. But the thresholds, I would say they're not too concerning. So it doesn't, the sort of risk doesn't really kick in for women until maybe 2 standard drinks a day to really elevate that risk. And the real concern is the emerging evidence in relation to alcohol consumption and cancer. So in relation to red wine itself, some of those things we thought might be, true in terms of the benefits to the body, they just don't really have evidence behind them, as it turns out. So they were things like, we thought maybe the polyphenols in the red wine were good for the heart, maybe the antioxidants were good for us, and even the tannins, but there's just not good evidence behind that. So unfortunately, the old red wine a day, theory is very much a myth. But if you want to, indulge in alcohol, you can, safely have 2, glasses, even 3 glasses of wine, at once. No more than 4. That's the threshold for harm according to the guidelines. But what doctors recommend is have a few days of abstinence. So if you're going to do that on the weekend, just have at least 3, ideally sort of 4 or even 5 days of abstinence through the week, and that really lowers your risk. So in terms of reaching for your drink of choice, red wine's really no better than or worse than any other.
Natasha, I think a lot of our viewers probably were blocking their ears for some of your chat then. It's news that I don't think we really wanted to hear, but probably news that some of us needed to. So really appreciate you bringing us up to date as we perhaps go off on our Easter weekend, ready to enjoy a few drinks along the way in a very safe manner, of course. Really appreciate you taking us through that. Thank you so much.
Bye, Ash.